Are you one of the 2 million people that have lost their Medicare Advantage plan? If you are, you might want to pay attention to this. Hi, I'm Chris Prang. I'm the Medicare analyst. I'm a licensed agent in 17 states, and my goal is to help people like you make a wise and confident decision about all of your Medicare choices so that you can protect your income, your assets, your savings, and your health. So, did your Medicare Advantage plan terminate? Hopefully by now you know the answer to that. If you got an annual notice of change, letting you know how it's changing for next year, obviously it's not been terminated. But if you got a termination letter in early October, hopefully you got it by then your plan is definitely going to be gone for next year, and you're going to need to find something else. And hopefully that's where I come in if you are from one of the 17 states that I'm licensed in, because what I want to do is help you find a good solution for 2026. And there are a couple ways that you can go about that. If you look at your letter, it's going to tell you that because your plan has been terminated, you now have a guaranteed right to get a Medicare supplement policy. And maybe you've wanted one in the past, but due to health issues, you would never qualify. Well, here is your golden ticket. Guess what? You can get one guaranteed, but your time is limited to do so. So you want to look into that. Typically what that means, depending on your age, you got to get a Plan F or a Plan G or the high deductible F or the high deductible G. Those are the kinds of plans that you're going to be looking at. So that would be option one, and then you would need to pick up a Part D drug plan to go along with it. Option two is you are happy with your Medicare Advantage, other than they terminated it, and it has worked well for you for whatever period of time. You like the way it works, and you want to stick with Medicare Advantage. Then hopefully what we can do is find you another good Medicare Advantage plan. And what I determined that good to be are a few things. One, how well are your medications covered? Because not all plans are equal. Two, are your doctors in network? Is your preferred hospital or hospitals in the network? Those two are the most important critical things that you want to look for in a Medicare Advantage plan. Number three thing you want to look for ideally for most people is a low maximum out of pocket. The lower, the better. Why? Because that is your financial protection in the event that something serious happens, hopefully not, but if you were to come down with cancer, kidney failure, or some other chronic condition where you were going constantly in for outpatient services, inpatient hospital, and you're paying all those co-payments, well, the sooner you stop paying, the better. So it's important to look for a low maximum out of pocket. The person that doesn't care, or that's not that important to, is if you're on Medicaid and Medicaid's paying the co-payments and it doesn't matter what the max out of pocket is, or maybe you're getting financial assistance from the hospital and they're paying or writing off more or less your co-payments. Other than that, you should look for a low maximum out of pocket. After that, then we are looking at what I call the bells and whistles, the optional benefits, the routine dental, the routine vision, the routine hearing, and the beloved grocery card, which there's not too many of those that are left on the plans. Unfortunately, what happens for most people, because of all the terrible marketing out there with Medicare Advantage, is the marketing focuses on the extras, the stuff that's not important, instead of the stuff that is. And people buy and they get enticed by the extras, like getting a grocery card for $50 a month or $100 a month, or getting over the counter, or getting dental and vision. And all those things are nice, but that's not why you pick a Medicare Advantage plan or insurance plan. You pick insurance to protect, again, your income, your assets, your savings, and your health, not to pay for your groceries. If you can get all that and have the grocery card, then great. So bottom line, if you are on a Medicare Advantage plan that is terminated, those are kind of your couple options. Let's go back to the supplement. So I mentioned that depending on your age, it's going to be Plan F or Plan G, okay? And you can look at a high deductible F and a high deductible G. And if you've seen any of my videos, the high deductible Medicare supplement is the best alternative to a Medicare Advantage plan. They are relatively low in premium, with typically in most places, the deductible or the max out of pocket is actually less than many Medicare Advantage plans. And then if you chose that or any Medicare supplement and you wanted dental, you could consider adding dental on top of it. Bottom line, if you're on a Medicare Advantage plan and it's terminated, you got two routes to go. We're going to go Medicare Supplement, or we're going to stick with Medicare Advantage. If you are from one of the 17 states that I'm licensed in and you want my help in finding a good solution for 2026, do realize that time is running out. You need to get it taken care of. So by all means, reach out to me as soon as possible if you want my help. What I will need from you, if you're going to do Medicare Advantage, is your medication list and your provider list, and then we're going to talk about what's important to you, what kind of other benefits do you want, how comfortable are you with the maximum out of pocket, and so forth. Or we're just going to go Medicare Supplement. If you can get through underwriting, you have a guaranteed issue right, but maybe you don't want an F or G, maybe you want an N, because most states with most companies, you don't have a guaranteed right to get an N. And an N, to me, is the best Medicare supplement for the vast majority of Medicare beneficiaries. If you're healthy enough, then we would go through underwriting. If you get approved, great. If not, remember, you got your guaranteed issue, so you would get a G, an F, or a high F, or a high G. Again, I'm Chris Prang. I'm the Medicare analyst. If I can be to help to you, please reach out to me. Make it a great day.